Hey guys, Dr. Jason Tirado, and thanks for being here. You know, ever since the release of Sam J. Gupta's Weed documentary on CNN, people all over the world have been paying attention to CBD's potential to help people with epilepsy, especially children with intractable epilepsy. That's the epilepsy which has really not responded at all to treatment. You know, I can't legally tell you that CBD cures epilepsy, and anyone that tells you that, I don't recommend that you listen to them at all. But what I can tell you is that CBD oil, the CBD oil without THC, can potentially improve the lives of adults, but especially improve the lives of children that suffer with epilepsy. You know, CBD can reduce seizures, sometimes even stop them inside their tracks, according to what I've seen, all without the negative side effects of commonly used epilepsy medication, which is known as AEDs. You know, however, it's really important to just keep in mind that CBD is not a cure-all for all epilepsy. I mean, there are some children who don't respond well to CBD treatment, and look, it just does not work for everybody, so please understand that it's not a panacea. You know, some of the side effects, although usually not a problem with CBD, are possible sometimes. You know, as a quick FYI, CBD oil with or without the THC should only be used under the medical supervision, especially if CBD is being used on a child with epilepsy. You know, CBD and other cannabinoids like THC and THCA have been shown to really work successfully as an anti-epileptic agent. And you know, the majority of research has been really focused on the CBD without the THC, because CBD without the THC has the ability to stop seizures without being a psychoactive. And this is really important for children as well as adults who aren't comfortable with the psychoactive effects of THC. That's the high you get with the THC. You know, CBD works to stop seizures by helping to improve the functioning of the endocannabinoid system inside our body, like we have a digestive system. The purpose of the endocannabinoid system is to maintain balance inside the body, and it's that system that maintains the balance by regulating all the activities of our nerves and the neurotransmitters, but most importantly by sending messages to the neurons to either increase or decrease their activity. And since seizures are a state of overexcitation of the nervous system, it's thought that the endocannabinoid system plays a real crucial role in decreasing the exciting of the neurons and the nervous system. You know, researchers believe that a poorly functioning endocannabinoid system may be responsible for these chronic seizures in children and in adults. So let's talk about some of the benefits of CBD for epilepsy. Again, you know, this is what everyday patients who are taking CBD for epilepsy are showing and what they're reporting. It's what I see. But they report reduction of seizures, improved alertness, increased appetite, better mood, better sleep, improved motor skills, improved social interaction, and decreased use of the AEDs, right? I mean, it's really amazing, some of these things. So what are some of the negative effects of using CBD for epilepsy? Well, one of the best properties of CBD is that it rarely has severe side effects, even at high dosages. I mean, that's incredible. However, that doesn't mean that the side effects with CBD aren't existent. Again, I just want to stress to you that the patients using CBD for epilepsy should only do so under the supervision of a doctor's care. You know, some people using CBD for epilepsy have reported the following side effects, such as diarrhea. They might feel sedated, they might get drowsiness, things like that. Nothing too crazy. But a lot of people ask me, can it interact with their current medication, you know, those AEDs? And look, there's always that possibility. You know, CBD is metabolized by the same group of enzymes which metabolize the AEDs in your body and many other medications. And drug interactions with CBD can occur and result in abnormal blood levels of the AEDs. This is why I really recommend for those with epilepsy to only add CBD to their medication under the supervision of a doctor. You know, your doctor may recommend that you adjust the dosage or time of the day in which you take your medicine, but it's really best that you work with a doctor who has a lot of experience working with CBD oil interacting with medication. You know, so how should you use your CBD oil for epilepsy? Well, look, patients with epilepsy use CBD a whole host of ways. Some will actually vape Some will take CBD oil. Some will take oral capsules, and some will also take oral concentrates. And sometimes they'll even take gummy bears. You know, CBD, to the THC ratios, which have shown to be effective, are CBD dominant ratios like 20-1 and 30-1, where there's not a lot of THC. And just like the cannabis medicine, patients should start with a very low dose and incrementally increase the dose every few weeks depending upon what kind of results you're getting, right?